Hello, everyone, and welcome. Thank you for joining us today. So let's start with Dr. DiFrancesco. Could you begin by explaining what exactly are clinical rotations and what is meant by the word rotations?
Thank you. So clinical rotations are an important part of any curriculum where the focus is healthcare. It includes optometry, medicine, pharmacy, nursing, et cetera, because in these fields, we are committed to taking care of patients, both on a one-to-one basis and overall population health. And with the type of responsibility that we have, that is the health and safety of our patients, we have to be well-trained and well-educated. And so it's the classroom learning, the knowledge that you learn in the classroom is really important, as well as the skills you develop in the laboratory. And those two go hand in hand to prepare you for a clinical rotation. And a clinical rotation is simply this. A rotation is an opportunity for you to spend multiple hours a week over the course of many weeks in a specific medical environment, a clinical environment. Clinical and medical we can use interchangeably for this discussion. And so you're there on rotation the whole day. And you're there every day and you work very closely with clinical instructors. Your clinical instructors are just like your classroom instructors, except now instead of the four walls of the classroom and the computer screen, you're learning with the patients right there, with the other medical professionals and medical students right there. We're learning together and learning to take care of your patients. And by the way, if you think about it, as you pursue your career and after you graduate and get your degree, you'll become professional in a work environment, and hopefully you'll have a long and satisfying career. But most of your learning will be done in the workplace. Yes, occasionally you'll go back to the classroom, maybe get an additional degree, or relearn some topics, some new topics. But most of your learning is in the work environment, and so that's why the clinical rotation is so important, because it allows you to apply what you learned in the classroom, and it allows you to apply what you learned in the lab in terms of skills. And secondly, it's the way for you to develop as a professional, the way for you to find the path of lifelong learning, where, as you know, in this day and age, the speed and change in medicine, technology, and knowledge is so rapid that we have to put extra effort in to develop those new knowledge and new skills. And we'll always do it in the workplace. So in essence, we will be preparing you to be self-directed learners for the rest of your career, so you can be the best that you can be.
Could you please break down the various parts of a program? Where do the rotations fit in a clinical program? If you could just give us an overview of rotations in a clinical program in general for any major.
Rotations are courses. You're grading in them, and they count as credit. You get full academic credit for your rotations. It's part of the curriculum. And so the curriculum is designed for you to learn first on an introductory level, where you take your introductory and early courses, and then you participate in your introductory or your early labs. And then from there, you'll participate and experience early rotations. That gives you sort of a baseline of knowledge, skills, and experience. So then you come back to campus after that first set of introductory experiences. We call them introductory pharmacy practice experiences, or IPPE for short. That's specific to pharmacy, but all programs have early experiences. You come back and now you engage in advanced coursework, advanced clinical coursework, advanced lab work. And lab is like rotation, except you're simulating the activity. And in rotation, it's real life patients in a real life clinical setting. So you go through that cycle of advanced coursework, followed by advanced laboratory work, and then your advanced rotations. In pharmacy, the last year of a Doctor of Pharmacy degree program, you're on rotation for the whole year. The experience is so important and so valuable that we commit 1 year of the curriculum, your final year, to being on rotation. So you're on rotation for the whole year. You go from one rotation to another. There are the rotations and their advanced pharmacy practice experiences, or API, and you have required rotations, but you also have elective rotations in this case, which are really important, since elective rotations allow you to either focus in a particular area of interest or maybe explore other areas that you're not familiar with, so that you have a well-rounded clinical experience which can add to your education, but also help you think about career decisions, so that you have as many experiences as possible. The other important thing about the clinical rotation is you get to meet people, you get to network, you get to learn about different organizations, different hospitals, different health centers, different community pharmacies, or whatever the discipline is. And you get to show people what you can do. Because, as a student, you're looking at different places as potential places of employment. And I can tell you from experience that these organizations that host you as students on rotation, they're thinking about their own needs in terms of hiring people in the future. So they want to, bring as many students as they can, so they'll have opportunities to hire. So that's the other reason why rotations are so important, not just to get the experience, but for you to develop a network of people that you can use as references, that you can use for recommendations, and possibly who can lead you to job opportunities. And so for all those reasons, the clinical rotation is just so very important.
Dr. Waldorf, could you maybe share some thoughts on the same topic?
When you're doing your clinical rotations sort of in-house, like, on campus, those are very standardized, where there's very specific goals and objectives that, we want you to meet. But I think in terms of like when you start going to external sites, it's really, it can be very eye-opening, because, I know for years when I was in school, I thought, oh, I want to work with geriatric patients. That's really my thing. And it wasn't really until I started to do my clinical rotations where I'm like, boy, I'm a pediatrics guy. I mean, I really, get along with the kids. And so, I think you kind of see things, you experience things, and in some ways there's also a business component to it, where you can see how, different practices might run. Do you want to be more like a big practice, or maybe a smaller practice, or in a community health center? So I think, that really can impact your trajectory in terms of like where you really want to end up and what kind of practice you want to end up based on the clinical rotations you do in your program.
What is the impact of the actual sites where they're going to be?
One of the advantages that we have is that, being in New England, in general, generally speaking, and in Boston very specifically, is we have major medical centers which are known nationally, and I dare say internationally, well known. And so at these, all of these medical centers are also affiliated with research centers. So you have parallel things going on at these major medical centers. In Boston, for instance, you have world-class healthcare, and you have world-class research going on at the same time. It's the pharmacy schools, the optometry schools, the nursing schools, the medical schools working together with the hospitals and the health centers and the pharmaceutical companies and, other entities, all working together, for the betterment of, patients everywhere. Get, students on rotation at MCPHS get to see that firsthand. They might be involved in some very unique medical care being given, or they may be involved in some research, some phase study that may be going on with a new drug that's ready to go, ready to be marketed. So there's lots of opportunities to see all the different sides of healthcare. There's the patient healthcare and the business and administration of that. Some students may be more interested in that side of things because you have to have very highly trained medical professionals, pharmacists, physicians, etc., who also can be the leaders and the business people and the financial people to make all these things work, because they just don't work on their own. So many opportunities to have a diverse education, and subsequent to that, so many opportunities to follow various career paths by being exposed to this major medical area.
Jasmine, you yourself are an international student. We'd love to hear a little bit more about your story, your path. Could you give us an introduction of yourself?
I am a Canadian student, so I am from Canada. I am in my final year of my PharmD program, and so it does say third year. So at the Worcester campus that I'm at, they have the Accelerated program. And so what this means is that you complete a traditional Doctor of Pharmacy degree in 3 years instead of the 4. Many people have heard of Mass General. You go on any TV show, you watch any movie that's based out of the States, you will hear about Mass General. And so I love to proudly say that I was at the specialty hospital, which is one of the top 10 in the world, and number 4 for eye care in the United States. As a pharmacist, I got to work in the pharmacy and provide a lot of patients with eye medications, and I got to learn a lot more and work closely with ophthalmology, which is where our IPE training really kicks in. It's where you get that you already have your opportunity to communicate with optometrists. So when I was there at that clinic, I was able to understand what they bring to the table. I was able to understand what they do and help provide my services as well. I did recently accept a position as a community pharmacist in New Hampshire, but this is important to note because I was able to get this opportunity through a set of interviews that were made available to students by our MCPHS case. This is our career services program, which actually brought in a lot of pharmacies and gave them the opportunity to interview students, knowing that we will be entering the workforce and will be looking for jobs. And so I completed a bunch of interviews earlier this year, and during that time, I did these at school, and I was able to collect some offers and make a decision on what I'm going to be doing even before finishing my rotations and graduating.